President Trump signaling he's open to easing federal guidelines, urging Americans right now to limit social contact and largely stay home. What could the medical fallout be? Dr. Peter Hotez is Dean of the National School of Tropical Medicine and Professor of Pediatrics, Molecular Virology, and Microbiology at Baylor College of Medicine. He has been a frequent guest for us, and he joins us this morning on the phone. Doctor, good morning.
Good morning.
Talk about the balance that the president has to meet right now in terms of getting this economy going again, but doing it in a way that does not spike the number of deaths.
Yeah, I mean, the president's in a tight spot, and, he's dealing with something that's unprecedented. Here's the situation. The reason you're doing the social distancing is because you want to avoid a huge number of patients in any particular city that's being affected from coming into the hospital at once. I mean, this is what's happening in New York City right now. I mean, hospitals are being overwhelmed by COVID-positive patients, patients in the ICU, patients in the hospital, and you have healthcare workers getting sick at the same time. So it's very easy for a group of hospitals to get completely overwhelmed to the point where they can't take care of patients. So by social distancing, you sort of spread that out over time and make it manageable.
Yeah.
I understand why the president is frustrated, and a lot of Americans are frustrated and want to restart the economy, and he's doing a lot of things at the legislative level. He's pressing hard on all those fronts. My take on it is this. We're just seeing now what the full impact of the epidemic looks like in New York City. Let's let this play out. Let's see what this looks like in a few more weeks. And what we really witness when hospital systems get overwhelmed, and let's get that victory under our belt in terms of controlling it. Then we can reassess and say, okay, how did that go? What went right? What went wrong? And then make a decision whether we want to relax some of the social distancing, but don't do it now.
Here's the president yesterday talking about that balance and how different areas of the country have different rates of people being exposed to coronavirus. Watch.
You have areas which are troubling, and we'll be working with the governor and the mayor and everybody else on those spots. But at the same time, at a certain point, we have to get open, and we have to get moving. We don't want to lose these companies. We don't want to lose these workers.
And on top of that, Dr. Birx yesterday at the same news conference, Dr. Hotez said that the best estimate right now of the mortality rate here in the United States is 0.7 or 0.8%, as in less than 1%. Now, every life matters, and you don't want to minimize any of them. But when the mortality rate is that low, what is the balance? What would be your advice to the president if, say, he's trying to make this decision this coming weekend ahead of the expiration of the 15 days to slow the spread?
So what I would tell the president is that, Mr. President, the mortality rate, that may sound like a low rate. In fact, it's about 5 or 6 times higher than influenza. And what's more, it's not just older individuals. We're seeing about, according to the Centers for Disease Control, we're seeing about a third of the patients who are hospitalized under the age of 40 or 44. And even though they're not necessarily dying, their lives are being saved because they're in ICUs being taken care of. And the reason why Italy looks like Italy right now is you have so many patients in ICUs that they just can't take care of them all.
Yeah. And
you're starting to see high mortality. So I would say, look, let's get one public health victory under our belt here in terms of what's going on in New York. Maybe we're looking at another month, and then reassess. And I agree. We can't stop our economy in perpetuity,
sure,
or even for 2 years.
Doctor?
But I think if you do it now, while the numbers are still steeply climbing in New York, and remember, now we're seeing a new epidemic coming on in New Orleans, so we don't really fully understand how this epidemic is going to play out. It's a brand new virus pathogen. Give it another month and reassess.
And carefully weigh all of that. I've got 30 seconds, Doctor. In terms of mortality rates, you talk about we've got to learn from Italy, we've got to learn from South Korea, from China. We've been looking at all these places around the world. Germany right now, the mortality rate is 0.4%. And a lot of doctors are looking at that, trying to figure it out. My understanding is that a lot of young people at the beginning of the outbreak in Germany got it and showed very mild symptoms. What are we learning from Germany?
I think there's that, but I think also it's the fact that the Germans got on top of it very early and started testing early, and the hospitals were ready, and they did it in a way where their hospitals were not going to get overwhelmed, because that's when the mortality rates go up. If you look at the difference even, say, between Wuhan in central China and other parts of China, it's because the hospitals got overwhelmed. They can't take care of the patients optimally. A lot of the doctors are getting sick, and that makes the difference between 0.6%, say what we saw in Korea, versus 3 or 4 or 5%. And it's all about making certain that hospitals can handle that surge. We haven't really shown that New York can do that yet, so let's hold on.
Pardon me, Doctor. We really appreciate your time. Dr. Peter Hotez has been a voice of calm throughout this. Appreciate you coming back.